Hello and welcome to my presentation. My name is Riley Stephan from Central Queensland University. I will present the potential positive and negative psychological effects of anabolic androgen steroid use, or AAS. What are anabolic steroids? Anabolic androgenic steroids, or AAS, are used as ergogenic aids by athletes and non-athletes to enhance performance by supplementing muscular development and strength. Anabolic steroids are a synthetic hormone which resembles testosterone in promoting growth of muscles, bone mass, fat distribution, sex drive, and the production of red blood cells and sperm. Testosterone is naturally produced in the testes in men and by the ovaries in women. But with the use of anabolic steroids, this amount of testosterone can be significantly increased. Although anabolic steroids can cause harm and side effects do occur, anabolic steroids' promotion of skeletal muscle, anabolic effects, and masculinizing properties, androgenic effects, in males and females allow this type of drug to become illegal in recreational use within the context of sport, bodybuilding, and weightlifting. Without a prescription from a doctor, anabolic steroids are illegal. Common names for anabolic steroids are gear, juice, roids, stackers, and the list goes on. They can be taken orally, injectable straight into the muscles, and some types of creams through the skin. All benefits of the juice is not without side effects or harm to one's body physically and psychologically. Some consumers who abuse steroids believe the benefits outweigh the negatives, or they can avoid unwanted side effects or even maximize the drug's effect by taking them in ways that include cycling, taking doses for a period of time, stopping for a time, and then restarting, stacking, combining two or more different types of steroids, pyramiding, slowly increasing the dose or frequency of abuse, reaching a peak amount and then gradually tapering off. Physical advantages of anabolic steroids occur within short periods of time. Some would include increased muscle strength, increased body size, healing rate, athletic performance, physical appearance. Of course, these significant positives come with side effects and serious irreversible organ damage such as decreased fertility, gynecomastia in males, masculinization in women, hypertension and atherosclerosis, blood clotting, tendon damage, psychiatric and behavioral disorders, and increased acne. Not only does anabolic steroids affect physical appearance, although psychological changes can occur, positively and or negatively. Psychological factors can sometimes be the reason athletes resort to AAS abuse. Some potential positive effects of using AAS would include enhanced focus on goals, improved self-esteem, better job performance, ability to attract partners, elevated mood, confidence, invincibility, positive aggression, the mental edge, and peer recognition. A research called Confidence by Injection by Ulrich 2011 concerning the psychological and behavioral effects of anabolic androgenic steroids, or AAS, was conducted. Psychological and behavioral effects were analyzed within 13 males who had used previously AAS. Findings were based upon perceived psychological functioning before, during, and after. Common social beliefs include heightened aggression, alterations in mood states, euphoria and depression, muscle dysmorphia, and concerns over psychological dependence to AAS. Now, 33 participants were former athletes and 6 were non-competitive bodybuilders. Age range from 18 to 35. Findings were 37 of the 39 men during the AAS using period were perceived as a positive experience, thus an increase in muscle mass, strength, and more importantly, perceptions of positive well-being. This case study could conclude that during anabolic androgenic steroid use, perceived psychological states such as confidence, self-esteem, mood, etc., all are positive. Although key findings were a lowered or negative effect on the participant's psychological state after AAS use. Furthermore, lower than before starting the AAS. This is concerning due to the risk of individuals or athletes gaining a psychological dependency on AAS. Through that case study and research, potential negative effects of using anabolic steroids can include increased aggression, increased violence, dependence, depression, guilt, higher alertness, irritability, anxiety, and negativism. These negative effects may not only occur during direct use of AAS, but are more commonly found after use. Due to these onset of negative psychological states for an individual, there is a high likelihood of psychological dependence. An athlete or recreational user could abuse AAS again to further gain the psychological and physical benefits and positives as experienced when on anabolic steroids. The guilt and depression an AAS consumer would feel after their cycle or using period would create a psychological dependence. This would create the user to become a repeat offender. For a consumer to feel those positive psychological effects again, re-abuse would need to occur, creating an addiction. This can be potentially far worse and more health detrimental than physical damage done by anabolic steroids. Physical and psychological benefits from AAS are easily seen and felt with almost instant gratification. The potential psychological benefits AAS can give an individual during use are amazing. Although psychological dependence and negativity are found straight after or after use, this can result in greater, bigger problems than physical harm. Depression and guilt are the major psychological factors that can cause a user to become psychologically dependent on the effects of AAS. Overall, the long-term negative psychological effects from AAS are extremely evident, outweighing short-term positive psychological benefits found within using anabolic steroids. Best case scenario for an athlete or a recreational gym goer would be to leave anabolic steroids alone. Thank you.